Okay, checking back in on progress with my hip labral surgery and FAI surgery. Um, Going into my fourth week now, things are going pretty good. First two videos I've posted, which you guys can see on my channel. First video was just the signs and symptoms that led up to me discovering that I had a labral tear and just making the decision to get the surgery done. And the second video was really more day of surgery and that first week, what that experience was like. So now, fourth week, I've got 1 week of PT behind me and progress is being made. So just want to kind of walk through that. First week of PT, not very eventful. I had a lot of restrictions on range of motion, so we couldn't really do much. It was really more just starting to wake the muscles back up. So like squeezing glutes, squeezing quads, really just laying there squeezing different muscle groups, trying to kind of reawaken them. So this week, got to do a little bit more. Um, Found actually a little bit of an alarming discovery. One of the exercises was to lay flat on my back, legs straight, and just lift my legs straight off the ground, and discovered that my leg would not move at all. It would not come off the ground at all. So that was pretty concerning. The physical therapist said it's a combination, one of muscle weakness, but two of the brain having to re-engage that muscle again, almost like a signal problem between the brain and the muscle because it's been 3 or 4 weeks since I've had to engage that muscle. I found it really concerning. So we took like an easier kind of I guess a cheat exercise to kind of start preparing for that since it wasn't ready yet. And I'm happy to say within a couple of days of attempting to do that, it slowly started to re-engage. Now I can get my leg off the ground about 10 or 12 inches. So it's more of a muscle strengthening issue now, so much as just the brain communicating. I think that part's good. So I think that'll be fine. Range of motion in all the other areas are really good, with exception to just bringing my knee straight up towards my chest. I can feel that kind of a pinchy feeling, actually the same pinchy feeling that I had before surgery. So I can only envision it's because, where the tear was, now there's sutures and anchors. So I guess it's going to take time for that to kind of smooth over and let it start to kind of rotate in that way. The rest of physical therapy went well. Still on crutches, hoping to start to wean off of those next week maybe. But we did do an exercise in physical therapy to prepare. So it was basically just get on my hands and knees and just kind of start to rock a little bit. I, just putting like 25% weight on that hip. No pain. It went well. So I don't think there's going to be any problems in that way. I don't really feel any pain in my joint area very often. It's really more, my pain is on the outside. The skin on my thigh is very, very sore to even touch it, almost like a nerve ending type pain. When my clothes brush against it, even it hurts really bad. It feels very bruised, and it's not on the incision area. It's actually kind of on the side of my thigh and the back of my thigh, which is strange. But there's a lot of trauma to that area, so that's probably to be expected. I did start massaging it once or twice a day, just hoping to kind of stimulate the nerve endings there and get blood flow going. And that's made a huge difference. Every day that I massage it, you can tell that it's hurting less and less. The surface area that was hurting is getting smaller, and it's also helped to under my incisions. I had like you could feel knots, and so I would take oil and just massage those with my thumb and try to push them down, and the knots are getting smaller and smaller. So I think that's been really helpful as far as getting the incisions to heal correctly. Other than that, everything's going well. I guess as to be expected. We'll see what happens when I start to come off these crutches next week. Just excited to walk again and take it on a test drive and see how it does. So I'll keep you posted. If you have any questions or comments, feel free to put them down below, and I look forward to seeing you again. Thanks.